Greetings, everyone. Welcome to another Prep Hour with Steve session. Today, we're going to be focusing on speaking. Hope this finds you well and making good progress to your plan of passing OET and moving forward with your career. I can see lots of people coming in. Just type in your location and time. It's 5 p.m. where I am here in Brisbane on the east coast of Australia. Hello to Nilafar, I can see you there. Hello to Baby and Kaushala, welcome to Eram. Some familiar names I can see. Hello Annabella and Aswan. Gudu, hello to you if you're watching this live. Just setting up all my streaming, everyone. Looks like if there's any tech support out there, I just have to make sure that Facebook, yes, here's Facebook working as I can see you there as well. Just a moment. I'll just turn that audio off. Hello to everyone on Facebook. I can see Hazel in Riyadh and hello to the Philippines. Good to see some people there. Hello to Oman, where else? Sydney, Turkey, everywhere. That's wonderful. We also have Zimbabwe. Hello, Kuwait. Raquel says, how am I? I'm feeling good. I'm feeling good, and I hope you are too. Hello to Zambia, Pakistan. So wherever it is you're watching from, hope all is well. Alrighty, let's get started, everyone. I'm going to share my screen, which means I will appear a little bit smaller, but that's okay. All right, so I love the OET speaking exam, everyone. How about you? Do you like the OET speaking exam? Such a unique exam that mirrors the workplace where you get to practice and develop your, clinical communication skills, talking directly to your patients. It's so important. It's such an important part of care, isn't it? And having effective health professional patient communication will lead to good outcomes for your patients and also good outcome for you in the OET exam. So OET is so unique in that sense. You're not asked to talk about hypothetical situations like in some exams. You're not asked to describe common foods or festivals in your culture. You're not asked to describe an image. You're not asked to do any of those things. What you're asked to do is demonstrate your communication skills when talking to a patient, which is, after all, what you need to be doing in your future workplace. So a great test, testing very real skills. And because of that, if you have the right approach and it can be narrow, you can build your skills and you can smash the speaking section, but it does require practice, doesn't it? So let's talk about what it is to start with. Just keeping up with my comments. Okay, so let's just do a little overview. Now you're speaking, if it's done, it could be a computer-based test where it's done on Zoom. Maybe type that in the chat box, everyone. Who's doing a Zoom? Who's doing a computer-based test? If so, you'll be doing it on Zoom. Who's doing a paper-based? If you're doing paper-based, probably your speaking test will be face-to-face. So share that with me, everyone, if you know. Will you be doing a face-to-face interview, or will you be doing a session on Zoom? Just checking for comments on that question. Paper-based for Sophia. Yep, and we've got the first question that Shim has answered for us. Who will do the interviewer? And yes, it'll be an interlocutor, not your assessor. So you don't have to feel the pressure of being judged while you speak. You'll have an interlocutor, and their role is to take the role of the patient, and you take the role of the health professional. All right, that's known, isn't it? How long does the speaking subtest take approximately? How long will you spend in that room or online or on Zoom with your interlocutor? 5 minutes, 10 minutes, 20 minutes? What do you think? How long to judge your speaking level? Few people coming up with about 20 minutes. I think so, because what's the procedure? Well, I'll bring this up. There's a greet and a warm up. That's not assessed, all right? And then there'll be 2 profession-specific role plays, which are assessed. Yep, 5 minutes each. Thank you, Vikas. 5 minutes for each role play. So actually, only 10 minutes of your speech, but that's enough to gauge your strengths and weaknesses and your clinical communication skills. So you need to shine in that 10-minute period. How long do you have to prepare? I think people know this one. How long do you have to prepare to read the role play card and decide what you need to communicate? Yep, that's 3 minutes, 3 minutes for each role play. And how many role plays will I do? Well, I think we know the answer to that. Of course, you'll do 2 role plays, different topics, and each role play will take about 5 minutes. So that's the basics. That's your 20 minutes. You've got to be calm, breathe, confident, believe in yourself as a good health professional. You've done the right practice. Then you just manage and lead that role play. Now, in terms of assessment criteria, it's very good to know our assessment criteria because it really helps us with our focus, doesn't it? So it comes in 2 categories. Category 1, that's a linguistic criteria. It is a language exam. So intelligibility, no, that's not a test of intelligence. Intelligibility means how clear your speech is. Is your pronunciation clear? All right, don't need to sound like a native speaker, but that's being assessed. Your fluency, not too fast, not too slow, because you are educating a patient. So you want to have the right pace. Appropriateness of language, that refers to not overusing technical jargon, but explaining medical conditions in a way that is easily understood by your patient. That is a real skill. You've got all this medical knowledge in your head, and you've maybe studied the Latin names of all the medical conditions, but that's not going to be clear necessarily to a patient. So you've got to be able to use layperson's language when explaining some of the details from that role play card, particularly that bracketed information, which can sometimes be quite technical. So your job is to simplify it. And then, of course, you've got resources of grammar and expression, which basically means good sentence structure, questioning technique, signal words, and organization to get flow happening in your communication. So that's all very important. But the really nice part of the criteria that's unique to OET and not anywhere else is that clinical communication criteria, which is relationship building, rapport, empathy, reassurance. These things are valuable, and it's part of your nature as a health professional to be. It's important that you do these things. For some people, it's second nature. For other people, they've got to work on that a little bit. Vikas asks, will they check medical knowledge as well? Not at all, Vikas. There's no test of your medical knowledge in this exam. You can use it to help you communicate effectively. It certainly can help, but it isn't tested. And the role, you could get a case, it's not in your area. You might specialize in a certain area. Maybe it's several years since you've thought about that topic. So, but you're going to have to talk about it. So no, you don't have to be an expert, and information will be given to help you with that in the bracketed information in the role play task. You need to be a really good listener. You've got to understand and incorporate what your patient is saying. It's not a textbook case. Your patient is real. So you've got to absorb what they say and then respond to that. We'll have a little look at some techniques for that shortly. It's also your job to provide structure, because let's face it, if we're a patient going to see a health professional, we want the information presented to us in a clear way that we can understand. So it's your responsibility to present that information logically. And again, that is a real skill that you need to develop. And the last two, information gathering and information giving. Well, information gathering, you need a good, robust questioning technique so that you can gather that relevant information about the patient and then respond in context. And for information giving, well, you're going to have to explain aspects of details about the medical condition or what it is, or about a procedure, those types of things. You're going to need to do that in a clear way. Okay, so that's what it is. So let's start with a little warm-up, everyone, a little bit of information gathering. I just want to check your language level here, everyone. One of the things that I notice is that asking questions, forming questions in English is probably the first skill you need to make sure you have, because if you have a bit of trouble asking questions, and that's a grammatical weakness that can reduce your score. So I just want to give you a little basic framework. If your patient has a history of pain related to their illness, well, we need to be able to ask about it. And the common questions that we ask about pain: duration of pain, the site or location of pain, the character, what type of pain it is, the time, it's going to be a when question, severity on that scale of 1 to 10, the cause of the pain, what was the trigger there, radiation, does it spread, or relief, what about medication that's being used? All right, I want to test your language right now. So have a go, everyone, and write some sentences that would help you express duration, right? Maybe you're going to begin with how long or when, right? Site, maybe you're going to begin with where. So I'll give you a few hints, and I want you to try to create sentences for me, and I'm going to check what you write. So maybe duration is a how long. There are other ways. Maybe site is a where. Character, maybe that's a yes, no question. Time could be a when. Severity, could be a how or something else. The cause, radiation, relief, you can think about those ones yourself. All right, answers coming in. Seba says, how long have you been experiencing pain? Excellent, Seba. How long have you been feeling the pain? Says Beatrice. Perfect. What else have we got? Yeah, lots of how long have you been experiencing? That's really good. How often do you get the pain? Says you. That's about frequency. Yes. A bit of a side question. Lloyd says, during preparation, am I allowed to make notes on the cue card? Yes, you are. And you might believe in recycling, and that's a great thing. But in terms of the exam, I wouldn't be trying to return a clean, unmarked paper. I'd be making notes and circling keywords. All right, good ones coming through. So let's have a look what I've got here, everyone. Simple. How long have you had the pain? There it is. How long have you had the pain? You've got to use present perfect. Have you had, right? Susanna says, when did your pain? Now, this is a really common one. I'll just bring this one up. We just had this one, everyone, and let's do a little bit of work on grammar. When did your pain started? Now, a common error in English is when did your pain started, because we want to put past tense on start. But actually, the tense comes from the auxiliary verb did. That's past tense. So this one is when did your pain start? Careful of that one. Another one for location. So location, getting some good ones coming through. Can you tell the location of the pain? Yeah. Where are you feeling the pain? These are good. And I think, can you tell me exactly where the pain is, to be really specific? Can you tell me exactly where the pain is? That's an embedded question, everyone. Think about this one. Can you tell me exactly where the pain is? That's embedded with can you tell me? Or if you were direct, you would say, where exactly is the pain? If you were going to do it direct, where exactly is the pain? What else have we got? Could you tell me the nature of pain? Getting there. Can you describe the character of the pain? Very nice. Why? Sophie says, how long do you have pain? No. How long have you had? That's got to be present perfect. So for character, everyone, can you describe the pain is a really good one. Can you describe the pain? And then your patient will, right? Is it a sharp or dull pain? That you can start with your yes or no questions. All right, that's a good one. Yeah. And for time, what have we got for time? When did your pain start? Good. Or when do you get the pain? Does it affect your sleep? There might be specific questions that you wish to ask. Severity, Andrew says, could you rate your pain on a scale where 0 is no pain and 10 is the worst or worst pain imaginable? And I like just to keep that one really simple. Could be 0 to 10 or 1 to 10, up to you. On a scale of 1 to 10, how would you rate your pain? Very, very common question in the hospital environment. The cause of the pain. Did anyone have a go with the cause? I'm getting lots of answers. What about the cause of the pain? Oh, Cindy gets it. Do you think anything triggers your pain? Nice, yeah. Or is there anything that triggers your pain? How severe is the pain? Nice one, Dino. Is there anything that makes it worse? Is there anything that makes it better? Is there anything that triggers the pain? These things need to be automatic for you when you're asking questions. Radiation, everyone. How do we deal with radiation? Radiation. You know, maybe the pain is moving somewhere. Good, nice one, Kenny. What were you doing when the pain started? When did the pain start? Yeah. Or Sarah, where the pain is? No, where is the pain? Yep. And for the radiation one, everyone, does it spread to other parts of the body? because you don't want to use the word radiate. It's a bit technical. Does it spread to other parts of the body? Nice one, Annabella. Could you tell me what aggravates the pain? Yep, good. Do you have the pain elsewhere? Yeah, that's quite good, Kenny. Does the pain radiate to other areas of your body? Yes, and I've just simplified it with spread. Does the pain shift? I wouldn't use the verb shift there. Does the pain spread or move, perhaps? And relief, have you taken anything to relieve the pain? Have you taken anything to relieve the pain? Right, so these are good questions. So one of the things that I would suggest that you do, especially if you're new to your preparation to OET, or if you're self-aware that you've got a bit of a weak area in there that you've got to work on, the beauty of OET is, look, just work on your questioning technique. Practice it, study it, review it. If you study with us at OET Online, we do a lot of work on questioning technique because it's vital part. You know, if you can't ask grammatically accurate questions, then you're in a bit of trouble with this exam, right? You're in a bit of trouble. You've got to get that B score. In order to get a B score, you need a solid questioning technique. So if you know that's challenging for you, just start practicing that area. Ask your friends about their pain. And it doesn't just have to be pain. It can be about flu symptoms. You might have questions about diabetes, to identify diabetes, questions about asthma, questions about eczema, all of these things. Okay, let's move on, everyone. Now we're going to do a little setting. We're going to do an example role play, but just remember the common settings. You know, the OET test for 12 professions, and common settings, you might be in a private practice or a suburban clinic. That's very normal. But you might be in a hospital. You could be someone's been admitted to the emergency department of a hospital. If you're a pharmacist, you could be at the local pharmacy or chemist. For radiographers, it's common that you're working within a radiography practice. Maybe the patient is nervous about undergoing an MRI. Maybe they have claustrophobia or a fear of radiation from an X-ray. Very common scenarios. Occasionally, you'll get a home visit where you're visiting the patient at home for treatment. If you're a physiotherapist, it could be at your clinic. Patients presented with perhaps a sprained ankle or lower back pain, frozen shoulder. You could be on just a hospital ward. The patient's been in the ward and is ready to discharge, but perhaps they don't want to discharge or feel ready to discharge. So you're going to have to provide reassurance. Could be a community health clinic, or even a suburban dental clinic if you are a dentist. All really, really common scenarios. All right, questions coming through. Look, we've got a comment from Fred. Fred passed OET medicine. Good on you, Fred. And you watched the YouTube videos and attended your live classes. Excellent, Fred. Please, you make it. On. Fantastic. I did hear results are coming out today for some people, so good luck to everyone getting their results. Okay. All right, so the basic structure, everyone, it doesn't change for a medical interview. It is an interview, hence you're going to be asking questions, right? So common structure, start the interview, quite common. You'll take a bit of history, but sometimes you don't. Sometimes you go straight to explaining a medical condition. So it's case by case or task by task. You will need to provide reassurance and education. That's your job. You are the expert. And then you'll end the interview. But all the time, you've got these overarching things. Provide structure with signal words, moving it forward. It's very easy to get bogged down in a section of the role play, but you've got to keep it moving forward. And you've got to build rapport. You've got to be that caring health professional that has that patient's best interest at heart. So a really good thing in speaking is to build rapport using positive language. All right, let's have a look at eczema in a child, a common case, everyone. So this is the health professional card. Your patient is a young boy of 5 who presented with his parent. He has patches of red scaly rash on his hands, the back of his knees and stomach. The rashes are itchy and they're cracked and weepy. And you've done an exam that reveals eczema. The parents tried to ease the itch with various cosmetic creams, but they don't work. That's our background task. You need to find out what the patient knows about eczema. Probably not very much, not as much as you. So you'll have information to give. Explain what it is: red scaly rashes, self-limiting, and who is commonly affected? Children. So we get a little bit of bracketed information so you don't have to be an expert. Explain the causes of eczema. Now, it might not be your area, so it's given to you. Certain soaps, woolen clothes, dusts, pets. Opportunity to ask questions there. Encourage the parent to monitor the diet of the child to determine the trigger factors. All right, so you're going to have to, maybe the patient's really worried and you're going to have to provide encouragement and motivate them to do that, and respond to any concerns regarding the duration. That's the patient card. It's 3 minutes to read it. Now this bit is, that's a health professional card. All right, just doing a general one. But then the patient card you're not going to see, but it is interested to see what it is. So you're the parent of a child. It's the same basic thing. Your child has those red scaly patches. They're cracked and weepy, getting worse. You've tried the creams, they didn't work. And you bought for the clinic to see what can be done. Now, the patient cards are fairly scripted with OET nowadays. It's like a set routine that that patient is going to say. So you're going to need to respond to that. When asked, say you don't know anything about eczema. So that means you're going to have to explain it. Say you're concerned at the diagnosis. Request details about the treatment options, what can be done, and how can the itchiness be stopped. So you're going to have to respond to that. And also, this parent's worried about the future. Ask about the future, whether the child will grow out of it. And say you're concerned about your other children, right? Whether they will suffer from the same condition. So you don't know these questions that the patient is going to ask. So you're going to need to be spontaneous. Okay, information giving. We've done the information gathering. We saw that with our questioning technique. Now let's have a look at information giving. So I reckon you can have a good framework for this. And this is just common for all medical conditions. Say what the name of the condition is. Find out what the patient knows. Then provide general information. You do not want to get technical here. Is it a virus, an infection, a disease, or rash? People get a bit bogged down wondering how much information to give. But as a general rule, not too complicated here. But you can explain who gets it and the common symptoms of what happens, treatment on how to manage the condition, and sometimes you might want to talk about risks and complications if they are significant. So that's just a basic checklist that you should go through when you're educating a patient about a condition. Okay, so let's look at a little dialogue here, everyone. I'm a big believer in dialogues. Who likes dialogues, everyone? Dialogues are really informative, I think. If you study examples of dialogues, that can really help you with planning your own communication. Now, on our website, we have lots of role play tasks where we have a sample audio and we have a transcript and then we have an analysis of that transcript. And it's a really good way to build your skills. So I'm just giving you a little extract of one of those here, everyone. Just a little taster there. So let's run through this, everyone. So health professional says, all right, Mrs. Small, let me have a look at John first. Then what does he say next? Fine. Based on my examination, your son has a condition known as eczema. Have you ever heard of this condition before? Now look at that, everyone. That's providing structure. They've added that there was no real examination, but just that statement. Let me have a look at John first. Fine. Based on my examination, your son has a condition known as eczema. So we've established it clearly and directly, but then because it's an interview, we need to know what the patient knows. So we ask the question directly. Have you ever heard of this condition before? Mother, as you'd expect, says, no, I haven't. What is it? Now we're going to use a little bit of a way to structure and organize the information. Instead of saying what it is, eczema is also called atopic dermatitis, pause and tell the patient what you're going to do. Well, I will explain it to you now. Always good to prepare the patient for the information first. Well, I'll explain it to you now. Eczema is also called atopic dermatitis. It's an inflammatory condition that is common in early childhood. So we're not too much detail, just an inflammatory skin condition. That's all we've said. But we've said it's common in early childhood. That's enough information. Mother, so is it serious? I'm really worried about John. You see, the rash has become cracked and weepy. Now that's our chance. We're listening carefully. I totally understand your concern, Mrs. Small. Let me reassure you that eczema is a self-limiting condition. That's borrowing from the case notes, but maybe the patient borrowing from the bracketed information, but maybe the patient doesn't know what self-limiting means. Well, you explain it. This means that most children will get better after a short period of time, even without any treatment. But of course, with appropriate treatment, the rash will heal more quickly. And that's a really good example. If you look at some of these responses, they're all 2 or 3 sentence responses. That's because as a basic rule, for every question that your patient asks you, you should give a 2 or 3 sentence response, a more detailed response. That way you're leading the role play. Don't wait for your patient to lead the role play. They won't, and it's not their job. Okay. Now let's look at giving some structure here. What treatment do you recommend? You know, this rash and itchiness have made John feel so uncomfortable. Now, active listening, yes, I can see that, Mrs. Small, but don't worry. We have some very effective strategies to help cope with eczema. There you go, reassurance, support. You got to put Mrs. Small's mind at ease. This is really, really important. You're building rapport, you're earning extra marks with your clinical communication skills while you apply these strategies. And then you say what you're going to do. I'd like to explain them to you one by one. Is that okay? That simple checking in, make sure the patient is keeping up. Remember, you're an educator. So you've got to structure it in a way that allows the parent to keep up with your communication. Let's keep going. Firstly, the rash might be related to an allergy or irritation. So please avoid things that may irritate the skin, like soaps, woolen clothes, and so on. Now we've got more information. Pay special attention to the food John eats to find the possible food that may trigger the condition or make it flare up. It's good language to make it flare up. It's also important to stop John scratching the rash, as it can make it worse. Is that clear? So now this is quite a lot of talking. It's quite a solid chunk of information that the health professional has said. So because of that, it's structured carefully so that it's clear and easily digestible. So what I suggest you all do when you're doing your own preparation, start writing out your dialogues, start applying this to your communication. And that is step one. Write your own dialogues. If you study with us, you've got model dialogues to work off to guide you, and start writing your own. And then once you've done that, that will help embed that knowledge, and then it will start to come out second nature as you practice it. All right, is that clear? Let's finish the rest of this, and then I'll get you guys to ask any questions. So it continues. Thank you. What about the future? I mean, will he grow out of it? Health professional says, that's a good question. That's an important one. That's a good question. Positive language. As I said, eczema is a self-limiting condition. When the skin function becomes more mature, this condition will heal and no longer be a problem. Then the mother says, what about John's brothers and sisters? Are they likely to suffer from the same condition? Well, it is possible because eczema does run in the family. If one child has eczema, then his brothers or sisters may be more likely to suffer from eczema than other children. But it's nothing to get alarmed about. The risk is very low. So you want to explain, if you're going to say to someone, it's nothing to get alarmed about, make sure you say why, right? And that's the role play, everyone. That's the situation. So study that pattern. If you're watching the video of this session, sit down now and write out some imaginary dialogues with a patient with a common condition, just to embed that knowledge, because that's the key to success. Any questions? Anybody want to text in a question that they have? Otherwise, we're going to move on. Lots of people joining us from different locations, which is wonderful to see. All right, I'm going to move on, but I will answer any questions that you do have. Oh, Ezra says, what if it's a midwife? Do they give scenarios for midwives? No, they don't really separate midwives as a separate profession. That comes under the category of nursing. But of course, you could have a baby with jaundice or, common pediatric conditions. You could certainly face those. Maybe the child has nappy rash or other common conditions for babies, so you could face that. Maybe it's breastfeeding difficulties or things like that. So there are areas that it could delve into. Gautam says, can we give extra information about the disease which is not given on the task? Yes, you can. You just have to remember you've only got 5 minutes, right? So, but if knowledge comes to your mind, or if you get an unexpected question or a question that you feel you can answer without looking at the card and you know what's correct, then you certainly can do that. So you can expand outside the range of the card. Always keeping in mind, though, that you complete your communication within that 5 minutes. And Aisha says, I'd like to ask you, what about the guide for an introduction in an emergency condition? I think it's a good thing to be direct there, Aisha. Like, you probably don't have to say, you could introduce yourself. That's a good idea. But you may or may not, you don't necessarily have to ask the patient's condition. You can go straight to the point. You know, what seems to be the problem? Maybe it's a parent with a child. Get them talking. If they're really agitated, then you can say, look, just calm down. You're in safe hands now. We're going to look after your child. I just need to gather some information. So I think in that emergency situation, it's important that you stay calm, even though the patient or the carer may not be calm. Sabah says, I used a lot of natural filters or fillers. How to come up with that? Do you mean fillers? First of all, in addition, also. I think it's just practice. Or do you mean, well, I see. I think in that case, Sabah, you just look at lots of examples, maybe from YouTube, and look at the natural fillers used by native speakers and try to incorporate those into your communication. What you don't want to do is you don't want hesitation, because then it sounds like you're lacking confidence. So you want to avoid hesitation when you communicate. That's really important. So, well, so practice that. Because says, close the question. I think for a good closer, you know, is there anything else you'd like to ask? Is there anything else you'd like to ask? And Sebi says, how to convince a reluctant patient. Good point, Sebi. How do you convince a reluctant patient? And you have a very high chance of facing something like that on exam day. Well, remember, in the bracketed information on your case, you will have a little section there that gives you advice about what the patient should do, you know. And remember, consequences. If the patient is reluctant to take the medication, then you need to explain the consequences of not taking the medication. Condition not getting better, symptoms worsening, possible heart attack, a life-threatening situation. You need to say what's going to happen if they don't follow your advice. Same, reluctant patient doesn't want to change their diet naturally. Well, you need to explain why it's important to change the diet and what will happen if they don't follow your advice. And we're going to look at that in just a moment. Depth, he says, is it compulsory to complete the task, or will that affect our score? No, there's no grade for task completion in speaking. However, I do think it's a good, I would set the goal of working through the 5 or 6 bullet points methodically and trying to complete them. But if you skip one, because that's the way the conversation naturally evolved, it won't impact on your score. They're more interested in what you actually said, right? If you do have trouble completing a task in 5 minutes, it could definitely be an organizational issue, lack of structure, and it could be also a fluency issue that you need to address. A few more questions coming from Azza says, would I lose marks if I said something other than written on the card? No, I think I addressed that before. Someone else asked a similar question. Question coming through from Priyanka, can we say suffering? Absolutely. So how long has your son been suffering from this pain? You know, because if you have pain, you suffer. And if the name of the patient's not written and it's a follow-up, then how to start? Good question. Well, I don't think the name of the patient will be written on the card. I've never seen that. It is a follow-up. Look, I don't think it's wrong to say 2 ways. You can assume, you can go, good morning, Mr. Smith, just use a generic name. But what I think you do when you're talking to interlocutor, they're going to ask your name. You make sure you know their name. Maybe they have a little badge, a little lapel label, or maybe they don't on their shirt. But Ask and write it down and use your interlocutor's name. That would be my advice to you, Alina. All right. All right. And Priyanka is also answering your question. Good on you there. That was very kind of you. Okay. Let's look at a few more situations, everyone. Another important technique for you guys is what we call the echoing technique, echoing what the patient said. So let's have a look. So if the patient says, "Oh, I just can't sit for long periods at work anymore. The pain in my neck and shoulders is really bad," then we can be direct. If it's affecting your work, we need to address that. You said you can't sit for long periods of time at work. Is the pain affecting other areas of your life? So this is really good because we know we've said things like, you said that can't sit for long periods. That's our echo. And then we follow on. Is it affecting other areas of your life? So exploring the issue further. Really nice technique. Remember, you get points for these skills. They're noted by your assessor. My father had a stroke at 55, and I'm worried the same thing could happen to me. And then the response, I can see why you're concerned, because that's an echo, because the patient said, I'm worried. So you're going to use a synonym, concern. Now that is a skill. I can see why you're concerned. Although strokes can be hereditary, it doesn't mean you will get it. Changes to your lifestyle can help prevent this happening to you. Have you ever considered improving your diet or doing regular exercise? There it is. That's the advice, right? Now, if the patient says, look at the next one. You said I need to change my diet and do more exercise. I can't do that. It's too hard. Of course, nobody likes to make these changes, right? But this is encouraging the reluctant patient. So what do? We let them know. It's difficult at first to make lifestyle changes, but it's important for your overall health. So what are we doing here? It's difficult at first to make lifestyle changes. We're showing empathy, all right? But we're not soft. We're empathizing, but we're staying strong. But it's important for your overall health. So it's your job to take charge and control. That's how you persuade the patient to follow your advice. Try gradually reducing your fast food intake and introducing healthy foods to your diet. In terms of exercise, try to get at least 30 minutes of exercise per day. Start by going for walks every day. And then I like this last question. Do you think you can do that? If you make that sentence, do you think you can do that? You're passing responsibility over to your patient, right? So that's really common and a nice technique. And also, you'll notice that the advice here is really concrete. Reduce your fast food intake and have healthy foods. No detail. You don't have to go and talk about the beans and the fish. You can talk in general terms unless the patient asks. Same with exercise. Be specific. Walking is always a good one. Or 30 minutes of exercise per day. Start by going for walks. So give concrete information. Don't make it general, is my advice. So there's some really lovely responses for you, everyone, in that echoing technique. Okay, so more questions coming through. Arisha says, if I mostly finish my task in less than 5 minutes, will it reduce my score? Look, sometimes that happens, but I think it's a responsibility as well of the interlocutor to manage that. So if they think it's going a bit quick, they can always ask extra questions. So I think that's not your responsibility alone. All right, any other questions coming through? Anna says, if it says you've just examined my child, do you need to introduce yourself? Not necessarily. Not necessarily, Anna. You can go direct. Well, Mrs. Smith, I've just examined your child and it appears they have eczema. So you can, for certain scenarios, if it's a known patient, remove that self-introduction. You know, when I go and see my doctor, he knows me, I know him. He doesn't say, hello, I'm Dr. Smith, right? He doesn't, because we know each other. So no, you don't have to, if it's a known patient, it's not necessary to introduce yourself. All right. So next one, basically just remember this, everyone. Think about these things. Control what you can control. You know you can control 50% of the role play because you're leading that communication. So it's your job to be organized and create a good structure. So work hard on those patterns like we discussed today, taking a patient history, explaining common medical conditions. But the other 50%, you can't really prepare for. You're going to have to respond spontaneously to what the patient says. So there will be spontaneous speech. But what you can do is know all those phrases. You know, that's a good question. I'm glad you asked. There's lots of language strategies there that will help you respond naturally. It's all about practice. That's number one. So that's your control. Two, give detailed responses. I said this before. For every question the patient asks, give 2 or 3 sentence response in reply. Give examples, give reasons, justify your advice, why it's important for the patient to adopt a healthy diet. You've got, and that's part of your persuasive skills. It's not enough to say you need to improve your diet. You need to say why. What are the consequences if you don't? That expansion is vital. And lastly, make sure you express the bracketed information in patient-friendly language. That's where you're going to have that jargon in the bracketed information. It's your friend, the bracketed information, but it does require that skill to expand in simple language. If you do all those things, you put in the right practice, you can ace the speaking exam. All right, I think I can take 1 or 2 more questions. Shivam says, how can I restart the pause conversation? Well, it shouldn't ever really be a pause, but the key word for you, Shivam, is now. When something's happened, now let's talk about the treatment options. Now let's talk about medication. The word now is a transition signal that indicates a change in topic. So that's the word you want for that situation, Shivam, and take the lead. Okay, all right. Now I want to tell you a few more things, everyone. If you do decide that you want to, look, there's lots of great stuff on YouTube out there, lots of great material, but sometimes, and we find this, a lot of students want to attend, especially when your exam gets close, a focus course. So that's what we offer. And I just thought I'd share with you something about time zones. So at OET Online, we do have 2 live lectures every day. And it doesn't matter where you're located. So can you see your location on the map, everyone? We've got the UK here. We've got Americas, North and South. We've got the Middle East region, many countries there. Africa, all over Africa. We've got India and the subcontinent countries, the Philippines. And the Philippines, we've got India, Sri Lanka, Pakistan, Bangladesh, all in that area. And then we've got the Philippines and also Singapore and Malaysia, these regions, Thailand moving into there. Don't forget Australia, down under, East and West Coast, and New Zealand. So it doesn't really matter where you're located. We've designed a schedule so that you're always going to get some classes that match your time zone. So we do offer morning lectures in these regions, afternoon lectures, and evening lectures. So you will, if you're worried about times, don't need to worry for our classes. And so you can attend live, because I think that's very important to fast track your learning. And all classes are recorded for viewing after the session, so you never miss a class. So check that out. And of course, as you know, we're an all-stars provider. We're officially endorsed for all 12 professions, the only provider that covers every profession listed. So we can help you pass. And I suggest everyone that if you've got an exam coming up and you do want to do a bit of preparation, come along to our website, and don't forget we got our free taster course, a taste of what OET study is like with OET Online. Really good if you just want to get it done. And if it's your first time to do this, everyone, I'll just put a little link in the chat box. Come along to our website. It's not going to cost you anything. You can go and have a look. Just post it up. Join our free taster course. You'll see what's in the taster course: sample videos, sample lectures. You will get sample writing tasks, speaking tasks, transcripts, audio. It's all there. A lovely little taste of what OET is like, reading and listening content, right? If you just need a bit of practice, there it is. If you need a bit more, at least you can judge. Remember, you can't always judge a book by its cover. You can look on the outside, but what's like inside. That's what our taster course will give you, everyone. So check it out. And I've just dropped it in the relevant chats. So go and have a look, everyone. All right. Well, I hope that's been a good session for you, everyone. You've been a great audience with lots of questions, and I'm really impressed everyone answering everyone else's questions too. So whenever your exam is, I wish you all the best, and we will see you in the next prep hour in another month. In the meantime, stay well, stay healthy, focused on the job, and continue to help all those patients globally around the world. Bye for now.